So during your NCLEX exam, you will see a lot of question about PPD, and you must know the content about PPD in order to crack the answer. So let's try 8 questions, and hopefully after this you will be able to crack a lot of answers. So let's try. So the first question is the right. If you know the answer, post it or say in your mind what is the right answer. So let's try. The right forearm of a client who had a PPD test for tuberculosis is red and raised about 3 millimeter, right? Where the test was given. This PPD would be read as having which of the following result? Intermediate needs to be redone, negative or positive. So first thing first, you must know if for normal person, if is less than 10, if it's less than 10, then we'll call negative. If it's more than 10, we consider as positive, right? So you have to know less than 10 millimeters negative, plus 10 is positive, plus 10 millimeters. Second thing you need to know, this is for normal people, but if the patient has HIV, right, and if he has duration, if the red area on the forearm, let's say, like, let me draw this so you will be able to understand more. So that is our arm, right? So they give intradermal shot here on the skin, right? That's called PPD shot. And after like 48 to 72 hours, you will ask the patient to come back for the reading. So if patient has like red bumpy like this, and if more than, this is more than 10, that's a positive, right? If it's less than 10, then it's negative. But if the patient has HIV, if they have 5 plus, that's mean already positive, right? For HIV patient, if it's more than 5, it's positive. But for normal people, they consider 10 millimeter, right? This is 5 millimeter. So hopefully it's clear for you guys, right? Now we're gonna solve the question. So the patient has red and raised about 3 millimeters, so where the test was given, right? So this test would known as, so our first answer come because it's only 3 millimeters, so that means this is the correct answer would be answer C, negative. Got it? That is our first answer, negative. Now go to second question. A client has active TB. Which of the following symptom will be exhibited? So those patients who have TB symptoms, the correct answer would be answer B. Patient will have chills, fever, night sweats, and bloody cough. That's called hemoptysis, right? Typical sign and symptoms are chills, fever, night sweat, and hemoptysis. Option A, chest pain may be present from coughing but isn't usual. And option C says, but client with TB typically have low grade fever, not higher than 1 or 2 Fahrenheit, right? And nausea, headache, and photophobia aren't usual TB symptoms. So your correct answer is answer B, right? That is your 2 questions. Now move to next question. Which of the following diagnostic test is definite of TB? Chest X-ray, Mantox test, sputum culture, or tuberculin test? So which of the diagnostic tests is definite for TB? So only the thing that will confirm is, that would be C, sputum culture. You must be thinking about chest X-ray, right? But the diagnostic test to confirm TB is sputum culture. So what happened, like for example, if your reading is 10 plus, the next thing is you will go for X-ray, right? And X-ray, they may not be able to see the lesions. So to only confirm TB is, they're gonna do sputum culture. And in sputum culture, will tell if patient has TB or not, no TB. Okay. Now move on to next one. A client with a positive Mentok test result will be sent for a chest X-ray, right? Which of the following reason is that done? So if a patient has positive result, right, and he sent for chest X-ray, what is the reason for that? Is that A, B, C, D? So the correct answer would be answer C. If the lesions are large enough, the chest X-ray will show their presence in the lung. Sputum culture confirm the diagnostic. There can be false positive and false negative skin test result, right? A chest X-ray aren't determine if there is a primary or secondary infection. So the thing is, they will send you for X-ray to determine the extent of the lesion, if anything able to show in the X-ray, right? So that's why they're gonna do X-ray. Now move on to next question. A client with positive skin test TB isn't showing signs of active disease, right? To help prevent the development of active TB, the client should be treated with isoniazid 300 mg daily for how long? So if a person has confirmed TB, so the doctor will prescribe the medication isoniazid and rifampin for how long? So the patient will go medication for around 9 to 12 months. Remember that. Sometimes it goes 24 months, but if you don't see option 24, then 9 to 12 months is your baseline answer. So if person has TB, the doctor will prescribe medication for 9 to 12 months and you have to take medication daily, right? Okay. The next question is, a client who is HIV positive has had PPD skin test, right? The nurse notes 7 millimeters area, right? So as I mentioned, if the person has 5 plus, that means 7, right? So he is already considered positive. So your answer is straightforward, positive. A client has a positive reaction to the PPD test, right? The nurse correctly interpret this reason to mean that the client has. So if a patient has positive PPD test, that doesn't mean that he has tuberculosis. So the nurse correctly interpret this reaction means that the client has. That would be answer B. Answer B. The person had contact with Mycobacterium tuberculosis. Okay. A positive test indicate that the client has been exposed to tubercle bacilli. Exposure does not necessarily mean that active disease exists, right? So that's why if somebody has positive reaction, that means the person had contact with Mycobacterium tuberculosis. That's a bacteria, right? And the last question is, the nurse obtaining a sputum specimen from a client with suspected TB for laboratory study. Which of the following laboratory technique is most commonly used to identify tubercle bacilli in sputum? So when you see this kind of question, you immediately goes to acid-fast staining. That's the diagnostic laboratory technique will confirm tuberculosis, right? So that's mean when so for example, after your positive reading, you will get X-ray, and they will you will also give your sputum culture, right? Sputum culture will go to lab, and they will do acid fast staining, and that will read if you have a TB or no TB. The most commonly used technique to identify tubercle bacilli is acid fast staining, right? The bacilli have a waxy surface which make them difficult to stain in the lab. However, once they are stained, the stain is resistant to removal even with acid. Therefore, tubercle bacilli are often called acid-fast bacilli, right? So, review one more time and after this you will be able to crack a lot of answers, right? So main thing, you already got it, right? So first thing first, they will give you shot in your forearm, if the in duration and red area. So you measure from beginning and end, like, and you measure the bump. You don't measure from here to here, you measure beginning to here. See how big it that. I'll post a picture above, you will be able to see and visualize how it's look like. Yes. So this is one of the famous topic for nclex, and you must know about this topic.